Hello, my name is Dr. Bob.
Hi. Nice to
Judy.
meet you. Alex.
Nice to meet you. Well, the reason why I'm here is I've noticed that you've had recurring chest pain, you've had difficulty breathing, you've had cough spells. Also, one of the classic signs of people that may have asthma is breath sounds that are wheezy. And not only that, but you've had performed tests that indicate that you do have asthma. Basically, I'm going to kind of explain what goes on the inside of the body when someone has an asthma attack.
Okay.
You have these airways in your lungs, kind of looks like a branching tree. They have big branches and it leads to the smaller branches. And they're tubular. They're hollow on the inside. And around these tubes there is smooth muscle. When people have an asthma attack, the smooth muscle constricts and it closes the diameter even more. And along with this, you also have inflammation of the airways, which closes the diameter even more. You also have mucus glands that enlarge. You have goblet cells that increase, and they secrete a thick, white, sticky secretions inside the airways. Now, just like the tree, I was talking about how the branches go into the smaller branches.
Right.
Some of this mucus can plug off some of your airway. You have air sacs, and it's kind of like if you think of grapes, then each grape is an air sac. And so these air sacs, the purpose of your lungs is to basically help oxygenate your blood, which feeds the rest of your body. And so when this mucus plugs some of the smaller airways, some of your air sacs will shrivel up, close off, or if it's not closed all the way, they can get larger. Both of these cause the blood to not properly oxygenate. So that's kind of what goes on when people have an asthma attack. I know it may sound horrifying. It sounds like a lot, especially trying to catch your breath, you're panicky. The good thing is that asthma is reversible. With it being managed and controlled, you're able to do your normal activities. You're able to do what you want to do.
Okay.
Do you have any questions?
What's the chances of it being reversed?
Well, asthma is a reversible disease, and again, if it's controlled, proper medication, watching out for it, it is reversible. And so you're going to have two RTs that are going to come in, and they're basically going to explain some of the medication that you'll be taking.
Okay.
They'll also go over a education with you to kind of give you an idea of what you need to do in certain circumstances.
Okay.
All right?
All right.
You have kind of a better idea of how it works?
Yes.
Okay. Well, thank you for your time. If you have any more questions, you can contact the office.
Okay.
My card's out front.
All right. Thank you.
Hi, Allison. I'm Bobby Jean from Respiratory.
Hi. Nice to meet you.
Nice to meet you.
Hi, and I'm Babette.
Nice to meet you.
Nice to meet you. So you met with Dr. Bob and discussed your recent diagnosis with asthma and kind of went over some things. So what we're here to do is actually go over some other things with you as far as any triggers and things that might prompt this in the future. I'm not sure what brought you into the hospital the first time, but we'll kind of go over some things that you can kind of avoid, things that are like in your lifestyle, maybe things in your diet, just ask some questions. And then we're going to have you, we'll do like a little test, it's a peak flow meter that can kind of help you if you feel like you're having one of those episodes or a moment where you can check this at home and you can kind of stay on top of your asthma so we can kind of keep you out of the hospital in the future. Okay? So some of the questions I want to actually ask you, is there anybody like your parents, any family members that have asthma, or is this just the first time that you have ever heard of this, that you know that? And it just happened to you? Did your mom or dad, anybody suffer from it?
Not my parents, but my aunt does.
Okay. Because a lot of times, sometimes it can be genetic.
Right.
Sometimes there can be allergies that can kind of prompt it. I don't know if you have any seasonal allergies or anything like that. But we'll kind of go over some of those things, and these are just kind of things to avoid, that you can maybe kind of stay away from or not kind of have them in your environment so it doesn't give you any kind of a flare-up. Sometimes what can happen when you're trying to get your air in and out, when things kind of constrict a little bit, it's kind of hard to get your air out, or you feel like you can't breathe. Sometimes you feel like you have like an elephant on your chest. Might feel a little tight, might cough up some stuff, might be kind of white, things like that. And this little device that we're going to use called the peak flow is when you have those moments and you feel that way, that you can check it. And right now we're getting you where you're stable and you're in good condition and your lungs should be pretty healthy right now, that we can get a good accurate number that's actually called like your personal best. And then I'm going to figure out some numbers for you, and so then you can kind of gauge that when you feel like there's a moment, like if you've been around something, if someone's worn perfume around you. Do you have any pets?
Yes.
And sometimes pets, the dander and stuff like that can cause it too. Are you a smoker? Okay. And even if you have family members or friends that are smokers, all those inhaled particles, dust, so many different things. And I'll send you home with some brochures that you can kind of look over, and you can read about it. Even kind of tells you too, like if you have like a cold or a flu, anything like that can flare it up. Weather changes, sometimes humidity, things like that can make it worse for everybody as well. And you don't use, or you're just now going to get started using like an inhaler. Have you ever used an inhaler before?
No.
Okay. Which is what she's going to actually go over with you.
Okay.
And I'll have you actually practice this, and we'll get some numbers, and then I'll let her take over, and she'll show you how to use your inhaler. So, and then I'll give you a graph, and we'll write your numbers down. We'll actually have you do it twice a day, but I'll go over that in a little bit. So when you follow up with your physician, you can take these in for him, and they can kind of help better manage your asthma and things like that. Okay. And certain foods can actually flare it, which this will go over that. Like I said, temperature changes, like the flu, anything like that, humidity, weeds, trees, grasses.
Right.
Springtime's always can be bad as well. But if we can get you to a point where we'd like you to not have to use your rescue inhaler, but if you do, you have it, you know the symptoms, you know what to look for, and you know what's going to cause it, and then that way you can stay on top of it. So just kind of makes it a little easier for you. This actually kind of goes over like with the animals we talked about, if there's molds, if you have any mold allergies that you know of, emotions, stress, anything like that can kind of cause it and bring it on. Exercise, if you walk or if you run or do anything like that, can bring that on as well. If you have candles in the home. So some of these, I mean, they might be things that you like having around, but they might just be adjustments that you might have to make to either get them out of the house, not be around them, just again so we can kind of keep you out of the hospital. Okay, so we'll go over with the peak flow. And I'll actually have a different sheet here that you can send home. I'm just going to figure out, how tall are you?
5'4".
5'4". And your age is?
25.
Thank you. So right now, when we do our calculations, this says as far as for the peak flow, that a maximum would be about 454 that you could breathe out on this little device, but that's not going to be probably true for you. So I'll actually have you practice this. We'll figure out what your personal best is. I'll write your numbers out, and then that way it'll kind of put you what they call a green, a yellow, and a red zone.
Okay.
And the green zone is going to be where you're doing really well. You might feel like you have something, but could be nothing.
Right.
You'll do your number, and if you're in where that green zone is, which they call it 80 to 100%, it's pretty much okay. If you want to use your rescue inhaler, you can, or you can just keep an eye on it, or don't worry about it at all.
Right.
You get into a 50 to 80%, you're kind of in the caution, in the yellow zone. And we usually actually like you to have, get your number, and you'll do it 3 times. And you're going to take the best, the highest number, the best number as your actual number.
Okay.
And if you're in your yellow zone, you can use your inhaler if you need to, and then just keep an eye on it. And about 15 minutes later, try it again. If your number goes up, then just keep an eye on it and don't worry about it too much.
Okay, so you do it 3 times, 15-minute increments.
No, actually, on this one, when you'll do it, and I'll show you. We'll have
Okay.
you practice when you do this. Then you'll wait. Or you actually can just plop it back down to 0.
Okay.
You'll just do it again.
Okay.
And you'll do it again.
Okay.
But it's when you use your inhaler that, if you need to use your inhaler, after you use the inhaler, give that a little bit of time because it takes just a few minutes to work.
Okay.
And then after you use the inhaler, then check it again.
Okay.
Okay, and then if the number,
After 15 minutes.
that'll be 15 minutes,
Okay,
absolutely.
okay.
And then if the number's up and it's better, just monitor and just see how you feel. Keep an eye on it.
Okay.
If for some reason you get in the 50% or below, it's the red zone, which can be the danger zone. And you'll know too if you're really feeling chest tightness and it's hard to breathe. And if your number is low, then you probably want to call your physician, but you might want to go ahead and just check your number. You can do your rescue inhaler. And if it just isn't doing anything at all, you really need to seek attention at the emergency department. Okay? Because we don't want you getting caught at home, no one's around or anything like that, and something could happen.
Right.
But I think if you use this though, it's really going to be a good monitor to keep you on top of your asthma. You're always going to know where you are, what your good number is, when to use your inhaler, and then we'll just have you jot these numbers down for your physician, and I have a graph for you, and you'll hang on to that, and then when you go in for your appointment, he can sit down with you, or she can sit down with you, and can discuss if you're doing pretty well, rescue inhaler right now is pretty good, or would they need to maybe add a steroid at some point, like things to keep the inflammation down. So that'll just kind of be up to how things go for you. Okay? So on here, and I'm going to send this home with you too. This kind of tells you you can catch your asthma early if you use your peak flow inhaler. Here's your nice graph. I'm going to have your numbers up here. I'm going to go ahead and actually figure your numbers. So what we do is we take that top number that was required for you, and we just take 80% of that, and that's going to give us 363. So I'm going to put your little green marker. So if you see you have a green marker, you have a yellow, and you have red. So just like a stoplight, green is go, it's good, yellow is caution. So we're just going to put this up to anything above 360. So if you actually hit anywhere green and higher, you're pretty good to go. Okay, and this is what's going to monitor that.
Right.
And I'll show you here in a second. And then in the yellow, anything above 220. So you get anywhere between the yellow and the green. That's where you're going to kind of watch it, use your inhaler. 15 minutes later, check it, see if your number goes up. If it kind of maintains, just see how you feel, but you may even need to call your physician at some point in the yellow if it doesn't improve either. Definitely if you get in the red or below.
Right.
And then anything, so we'll put the red there, anything below that is when we get concerned and you need to call your doctor. Okay? So what you're going to do, this is like your little handheld thing to hold this with. This will be your mouthpiece. And what you're going to do is just let out all your air, and then when you're ready, take in a big deep breath. You're going to seal your lips around this. You're going to blow out really hard and really fast because you want to blow this little red piece right here is going to move up. Okay? So when you're ready, just blow out. Good. And your personal best. So that number, we're going to do this 3 times. So we're going to get your best number, okay? And this is at 430. That's a pretty good number. So we're gonna do 2 more. Excellent. So right now is the best time to get this because you're not having any reactive airway disease or any kind of inflammation going on right now. So this kind of gives us a good number what to base you on. So we'll take your top number. So right now your top number is at 460, which is really pretty good. So I'm going to write that on your diagram here down in the corner, and that's kind of something that you can shoot for. But if you don't get that high, that's fine. As long as you're in that 80 to 100%, that's not a whole lot cause for concern to worry about that. So I'll write that on there. 460 is your personal best. So when you look at that on your diagram, you're already in your green zone.
Right.
But anytime you get in between any of these numbers, like I said, yellow, caution, see how you do with your inhaler. Anything below that in the red, cause for concern, call your physician.
Okay.
Okay? Any questions for me on that? Okay, so I'm gonna send you home with all these, so you'll have that. If there's any kind of adjustments or changes, the pets I know are always really hard. I have pets too, so I would always find that it's hard to, you don't ever wanna have to get rid of your pets, but just know that they could be a caution for concern, that they might give you flare-ups, and you might have to use your inhaler a little more than necessary. Okay? So we want her to take over, and she's gonna show you how to use your inhaler, and that's just all gonna tie in with your peak flow as well. Okay?
Thank you.
You're welcome.
Okay, so I'm going to show you how to use your inhaler and your spacer, and I'm going to reiterate a little bit on what Bobette said. And so this is your inhaler, and it's your inhaler to take home.
Okay.
Okay, before you use it, you're going to want to shake it, and I'm going to get my other glove on real quick. This is going on your mouth, and I don't want any germies. So you're going to shake it a couple times, 3 or 4 times, shake it, and then you're going to actuate it, which just means making it puff a little bit.
Okay.
So that clears off the dust, anything that might be on it. And then this is your spacer. And there's a space right here for the actual inhaler to go into your spacer, okay? The good thing about this is when you press it down, you'll still have time to take a slow, deep breath in without it hitting the back of your throat or any of the medicine dispersing other places. So you're gonna make a tight seal with your mouth, press it, slow deep breath in, hold it for 3 to 5 seconds, and then you're gonna breathe out, and then you're gonna wait about a minute preferably, and then you're gonna do another puff. Same thing, slow deep breath in, wait 3 to 5 seconds, and then you're done. And this is as needed, or depending on how your doctor orders it, whatever time frame that is, and then as needed if you feel like when you do the peak flow and it's down in the yellow zone or even in the red zone, use it when you feel like you need it, or if it's tight or anything. And then also, if you don't have your spacer with you, say you leave it at home and you feel like you're having some chest tightness or it's hard to breathe or anything like that, you're going to take 2 fingers like this, distance away like that, press it, and it's a quicker breath in, so the medicine doesn't disperse anywhere else. And you're gonna do same thing, hold it, wait a minute, and then do another puff. Okay, and then this is gonna be yours to take home. Also, we're gonna go ahead and practice it. So you're gonna do it. Sorry.
Okay.
Open it. And then you're going to shake it and actuate it. That's it. Here you go. And then
Does it matter how long you have to just a couple shakes?
Just a couple shakes.
Okay.
And then you'll place that in your mouth, make a tight seal,
Okay.
and then press it and then slow deep breath in. And then breathe out. And then we're going to wait a minute. Minutes gone by. Same thing. So breathe out, press it, slow deep breath in, hold it, and breathe out. There you go. And then that's yours to take home and keep. So, do you have any questions with that?
For like cleaning purposes, for
Cleaning purposes, for this one, when you actuate it, it should get all the dust particles out, so you don't really have to do anything with that. But if it does get a little gunky in there, this comes out.
okay.
And then you want to take it in warm water with some mild soap and just
Okay.
shake it. Always air dry it. Don't ever use any kind of towel or anything on it. Let it air dry. And then also with this, same thing. Warm soapy water in the sink. Dip it in, go back and forth a little bit, and then let it air dry because you don't want any like the fabric particles or anything else to get stuck to it if you dry it with a towel. So just let it air dry. I suggest doing that at night while you're sleeping so it dries during night.
Like once a week or just
once,
if you feel.
yeah, when you feel, yeah, once a week, or if you feel like, oh, this is getting cloudy and it shouldn't be.
Okay.
Yeah.
Okay.
So that's yours to take home, that's yours to take home. Do you have any other questions for us?
No, I don't think so.
No, are you sure? Nothing? Okay. Well,
All
she's
right.
got papers for you to take home for the peak flow. There's some brochures about asthma too, so.
And just a reminder on this, it has the day of the week, your day and your time that you do that,
Right.
and the spots to put your numbers in.
Okay.
Keep a hold of that and take that to your physician for your next appointment. All right. Well, if that's it, then good luck with everything. If there's ever any questions, you can give us a call or check with your physician. His office staff can help you. But hopefully staying out of the hospital is key.